clinics here in Marple and Heaton Mersey, and I really appreciate you taking the time to spend with us just for about 45 minutes to an hour tonight, just to understand the big picture of what we're trying to do. Our real passion is to really help you get really great results, get rid of your pain, but then also improve function. I know you could be doing something much more exciting tonight, but I really do feel, and we know from our experience, people who understand their problem a little bit better, and people who put a bit more effort into looking after themselves get much better results. And really, that's our passion. And at the moment, especially, we filmed this during the COVID-19 lockdown, I think everyone's becoming aware that if you've looked after your system, you're much less likely to struggle with such a condition, such as a virus. Obviously, it's a bad one, but ultimately, I think that's the big picture. We will get someone afterwards to ask, you can ask any questions to, but please speak to the chiropractor. And I do apologise, we can't do this live. It's just that I can't be in all the clinics 2-3 times a week doing this talk, as it's a little bit time consuming, but I think you'll get all the benefits today. So again, thank you very much. So my name is Dr. Andrew Jackson. I'm a chiropractor. I got into chiropractic many years ago. I've been a chiropractor for 20 years, and today I'm really going to talk to you about how to help with your pain, your spinal pain, your headaches, your migraines, any condition you're struggling with. I believe we'll go through today and help you with. So what you will hopefully get from today is you're going to get the understanding of how your spine should function, how we can address your pain, and that pain can sometimes be your friend, which is a strange saying potentially, and then what the causes of these problems are, and then finally what we can do about them. So I hope that makes sense. Again, just before we continue, I'd like to appreciate and thank you for showing up. One of my mentors or people, one person I really look up to, he said the secret to success is to show up, and you guys being here tonight have shown up, and that really means that you're concerned and really interested in getting better, and that's 90% of the problem already dealt with. So again, well done, and that's brilliant. Just as we're going to spend a little bit of time together, a little bit about myself. I initially was a tennis player, or trying to be. I was bidding Bjorn Borg back in the day. If you're that old, you'll understand what I'm talking about. Ultimately, I wanted to be a tennis professional. I got a scholarship to America, played tennis there on a scholarship playing tennis, but I kept getting injured. I was doing well at times, but I kept getting injured. My shoulder, my neck, and then all of a sudden I had paralysis on the side of my face, and I had something called Bell's palsy syndrome. This 7th cranial nerve got paralyzed. We have no idea. I got gut issues, bloating. My posture, at that time, I didn't even think about it. I had a kyphotic posture. My head was forward, and I wondered what was going on. Obviously, my sister is actually a GP, and my family are very medically orientated, and I went down that route initially. But being only young, it didn't make sense to me. Why was I struggling so much? So after looking into that, a friend's dad in the States was a chiropractor, and he consulted, or he went through and gave me some advice, and he said, Andrew, look at the body. It's self-healing, self-regulating. If we just look after it well, we can really help you get better. So he looked at x-rays, he looked at my posture, and he said, Andrew, your spine is not healthy, your posture is not healthy. How can the brain perceive your body? So just from a little, I didn't actually have treatment back then with him, because I went back to Europe to study at the Anglo-European College of Chiropractic, which took 5 years full-time. And then a colleague of mine, I actually worked for a year in London, and then a year later, a colleague, a friend of mine, who came to Manchester and set up some clinics, and we're here now. However, I then progressed in terms of my studies to more functional neurology and functional medicine, to understand that the spine is huge, but if you can integrate good eating habits, good lifestyle habits, understand the brain a bit more, we'll get even better results. So my passion is to help everyone to the nth degree. I spend so much time studying and learning all the time, just because it's fascinating, but also I really want to help people do much better. So I want to ask you all a question. As a society, would you say that we're actually getting healthier as a society, or sick as a society? So obviously I can't see you putting a hand or give me answers, but I'd like you to know that in 1980 the NHS spent approximately £10 billion on healthcare or sick care, whatever you want to call it. So £10 billion, mostly on surgery, on medications, etc. Can you imagine or can you guess how much we spend now on the NHS in terms of healthcare? Well, it's actually 10 times, more than 10 times that. We're spending more than £100 billion on healthcare. So it's gone from 10 billion pounds, so 10 billion pounds, to now 100 billion pounds on healthcare. And that's a vast amount, you can probably agree. And what's the majority of money spent on? Now, before I go into that, there's two types of diseases or forms of disease. There's disease which we can use and describe as acute disease, so something that's very sore, it's quite new, it's been not there, but it's painful and it's a real problem. That's acute. And then there's also chronic disease, so I'm going to write that here. Chronic disease. Now, you probably can imagine that the majority of the money of the 100 billion, which is actually more than that, is spent on chronic disease. Probably 80 to 90% of that 100 billion is spent on chronic disease, which is obviously a lot of cost to the NHS, a lot of cost to us. So, understanding that chronic disease is taking up a lot of our NHS money. These are examples of chronic disease on the board here. So examples of chronic disease are obesity, diabetes, heart disease, dementias, arthritis, spinal pains, cancer, osteoporosis, migraines. These are all chronic diseases. Now, would you say that even though we've spent £100 billion on chronic diseases, are they getting better? Are we dealing with them better, or are we struggling more with them? And I'd probably argue with you that we're actually struggling a lot more with chronic disease, even though we're spending way more money. So that's really important for us to understand, is that we're spending more and more money, yet we're struggling with that. All of these are going up. We are struggling more and more with all of these diseases all the time. So we're spending more money, but they're getting worse. So we have to look at why. And we're going to look at the why now in terms of the causes. And ultimately, the causes are our body's inability to deal with stresses. And we're going to go through those stresses now. But there's three types of stress. There's a physical stress, there's a chemical stress, and there is an emotional stress. And each one of these stresses accumulate and affect our bodies from birth, or sometimes in the womb, and they accumulate, and all of a sudden our bodies can't adapt. So different types of stresses that affect us, and they affect our health, they accumulate over time. Physical stress, chemical stress, and emotional stress. Examples of physical stress are our sedentary lifestyle, sitting behind a computer for many hours a day for 30, 40 years without exercising properly. Poor quality mattresses, pillows, couches, not moving enough, all these remote controls, cars, we don't walk, we don't move like we used to. And then examples of trauma physical stresses are whiplashes. Long term, they have a significant effect. So many patients I see 20, 30 years prior, they've had a whiplash, and I can bet £1,000 that that's been the precursor to the start of their problems, because it's really affected their spine. So those are examples of physical stresses. So we're designed to move. Our bodies aren't moving either from lack of movement or through trauma. Chemical stresses. That's a very different one in the Western world, because we're all seduced by tastes and flavours, too much sugar, too much salt, E numbers, etc., too much cream and fat, etc. And those are chemical stresses. So sugar, salt, caffeine, too much caffeine. Coffee is not too bad, we shouldn't drink too much of it. Poor quality meats we eat, if they're mass-produced, corn-fed. If we eat farmed fish, if we eat additives, Chinese food that has MSG in it, monosodium glutamate, a neurotoxin. Any chemicals we expose ourselves to, like for instance fumes from the car, or living in the city, is a chemical stressor. We're breathing those stresses. So that's an example of chemical stresses. We're really designed to eat a Paleolithic type diet, the hunter-gatherer diet, with lots of fruits and vegetables and berries and seeds and nuts and good quality meats, lots of water. That's what makes our body healthier. And then emotional stresses. So the emotional stresses are the ones that we worry about with finances, with bereavements, with breakups, with worries about work, worries at this time with COVID. They say 40% of businesses are going to go under in the next few months. That's a huge worry, financial, and then worry about your family, and then relationships. What's going to happen to relationships when you're under so much stress? They're going to go in the wrong direction as well. So that's a huge effect, especially at this time. So these stresses are going to accumulate and affect how our body can function. I hope that makes a little bit of sense. Okay, so we understand that stress causes poor health. Now this is the physiology of stress. This is actually out of a medical textbook, and it really talks about how the stress response is it's a life-saving response, but in this Western world it's actually created health problems. But ultimately it's down to us. We have to understand it. So on the left, your left, this is the sympathetic response of the nervous system. This is the flight or fight, also known as the flight or fight response. On the right, this is the parasympathetic response, also known as the digest, relax, heal response. So they're two different responses. So you can imagine an analogy is a car with an accelerator here, and then here's the brake. The sympathetic stress response is your accelerator, and ultimately it's there to allow you to survive. It is the bear jumping out of the jungle wanting to eat you, and your brain perception of that has to change the physiology of your body to allow you to escape. Now, to escape, you don't need to have high brain function, you don't need to digest food, you don't need to get pregnant, you don't need to do all these things, but ultimately you need to get a lot of fuel to your muscles and joints. So the way the brain does that, it says, okay, I need to increase my heart rate, I need to increase my blood pressure, I need to increase my breathing to get and push the sugars to my muscles and joints so I can run like crazy or fight like crazy. So heart rate goes up, blood pressure goes up, breathing goes up. At the same time, sugar is liberated, is liberated from the liver and some other areas. Sugar is liberated, and so is cholesterol to make those muscles and joints work better. Cholesterol is liberated because it's a precursor for adrenaline, part of the stress response. Cholesterol is also part of coagulation in terms of clotting. So cholesterol is needed. The brain might be thinking you might get bitten or a wound. So cholesterol is released, sugar is released, blood pressure is up, heart rate's up, breathing's up. At the same time, when you're in the stress response, you don't need to digest food. The gut doesn't need to be working. It's not an imminent issue at the time. You don't need higher brain cells. You don't need to be doing calculus or Einstein's fourth law of physics or whatever it is. You don't need to be pregnant. You don't need to get pregnant at that time. Obviously, that's not an imminent need at the time. And you don't need to boost your immunity. Your immunity doesn't need to be kicking in at that time because it's not needed at that point. There's a more imminent danger. So you can understand this is the response back in the day when we were hunter-gatherers. We ran away from the tiger. Hopefully we didn't get caught, and then we went back to our cave. We slept it off for half an hour, and our whole body system started to calm down, and we went back to digesting and working, and our body started to work beautifully. But now in this Western world, we have these stresses which accumulate from bad food to sitting all day to emotional stresses to COVID-19, and they accumulate, and we wonder why we're stuck in this stress response. And when we're stuck in the stress response long enough, it becomes chronic, and we plasticize, the brain plasticizes it, remembers this. This is normal for the brain now. It's a vicious cycle. And we've heard of people with fibromyalgia or chronic fatigue or RSD, reflex sympathetic dystrophy, when their pain is just amplified all the time. The brain just perceives that this is normal. And if we're stuck in this stress response long enough, we get bloating, indigestion. We have problems getting pregnant. 1 in 4 couples have problems getting pregnant now. Our immune system is decreased because the stress response puts lots of hormones or a lot of steroids into our system, which decreases the immune response. So being stuck in this response in this Western world is not healthy long term. And we have to imagine, or we have to remember, that getting out of this response is the secret to health. What I'm going to do now is my colleague Jess, who's the queen of cinematography, is going to show you a little video, a 3-4 minute video. It's an animation which really gives you a good idea of chiropractic and the spine, and then I'm going to go through that with you. just right after.
If you're watching this video, you're probably curious about chiropractic care and how it can help you and your family. So let's explore what chiropractic is all about and how it works. A chiropractor is a healthcare professional who specialises in the health and function of the spine and nervous system. Because of this focus on the spine, many people think that chiropractors can only help with problems such as back pain, neck pain and headaches. But there is much more to chiropractic than this. Chiropractic care is really about total health and well-being. It's about helping people to feel great and get the most out of life by functioning at their optimal potential. The spine is there to protect the spinal cord, which is part of the central nervous system. The spine is like a set of armour made up of segments so that it can bend and move naturally with the body. A spinal segment consists of two vertebrae and the joints that connect them. There is a disc between each vertebra that acts as a cushion. Underneath that armour, a whole lot is happening. Messages travel from around the body, up the spinal cord and into the brain. The brain processes those messages and sends replies back down the spinal cord to tell the body how to respond. The central nervous system is one big information highway, and it carries vital messages to every part of your body. Sometimes the wear and tear of everyday life can impact the spine and cause spinal segments to move in a way that is different to normal, in a dysfunctional way. That wear and tear can happen gradually, such as from bad posture, or it can happen suddenly, which is common with sports injuries. And because of the close relationship between the spine and the nervous system, everyday strains can actually impact the flow of information and communication between the brain and the body. Messages may not be delivered to the brain, or they may be inaccurate. When that miscommunication occurs due to abnormal movement in the spine, chiropractors call this a vertebral subluxation, or a chiropractic subluxation. You may hear it again from your chiropractor, so now you know what it means. By making fast, gentle adjustments to the spine, chiropractors restore its natural movement. If the central nervous system is like the engine of your body, a chiropractor acts like a mechanic, tuning the spine and central nervous system so that your body can run like a race car. Just keep in mind that as you are adjusted, you may hear a popping sound that can seem a bit strange. In fact, it's completely harmless. It's just the release of gas from between your spinal segments, and it's no more significant than any other release of gas from the body. So, are you ready to supercharge your engine?
Okay, everyone, I'm back. I hope you enjoyed that animation. It's very informative and it's so well done. In fact, the lady who makes these animations, her name's Heidi Harvick. She's a chiropractic researcher. She's published many books on spine, brain, the effects of chiropractic adjustments on the brain and health and decreasing pain long term. So she's got millions more on YouTube. Her name's Heidi Harvick. Just Google her and YouTube her, and fascinating. So I'm just going to summarize. We have this amazing structure, and I always say this because you don't see it. It's hidden behind here, and it's such a complex structure, yet it's the most important. It's pretty much the most important structure in your body because it's the cable, it's the bridge between your brain and your body that's allowing the spinal cord and the nerves to exit, to make your body work, to make it run, to make it work beautifully. Your computer sits up here, sends information through those nerves go to all your cells, your organs, your tissues, your muscles, and then the information comes back to the brain. So it's like a closed loop of function. Now, in the clinic we have little leaflets. We talk about spinal hygiene, just like the dentists use the term dental hygiene. And the reason we use the term spinal hygiene is because there's three simple aspects to a healthy spine. Number one, the spine should be in good alignment. So it should be straight from where you're looking from. It should be straight, otherwise you've got something called a scoliosis. Side on, we should have nice curves. So you should have the lordosis of the neck. It's like these curves are like the springs in the car. You should have the lordosis of the neck, the kyphosis of the mid-back, and the lordosis of the lumbar spine. That's normal, and that's normal alignment. So that's number one, alignment. Number two is mobility. You have 24 movable vertebrae in the spine. They should all move beautifully. From here, all the way there. And then you have the sacroiliac joints, etc. But all these vertebrae should move. And with life and stresses, which we've already talked about, sitting too much, bad quality food, the muscles tighten, and they start having an effect on the mobility of the joints, which leads to these, what we call chiropractic subluxations or misalignments. Another way of describing them is calling it a joint position error. The joint is out of position. There's an error in the signal to the brain's perception of that area is not as clear, so that the body's control of function is again not going to be as good. So it's just like you service your car frequently to make sure that the alignment is in good nick and the car is going to run beautifully for life. So that's number two. Number one was alignment, number two is mobility, number three is core strength. We've heard about Pilates and yoga and core strength. Core strength is so important because it's the muscles that hold your spine up in that position to give you good strength. Now, sedentary lifestyles, not moving enough, our core strength gets so poor, we have babies, and we don't look after ourselves, and we just say it's our age. Age is a number. You mustn't use that excuse, because you can look after this amazing architectural specimen, your spine. You don't see it. Everyone on the planet should get their spine checked once or twice a year, even on a preventative basis like you do your teeth. Okay, I hope that makes a lot of sense. So in the spine you have the discs, etc. Those should work beautifully, and you should look after it. Now the spine should have these normal curves. We look at x-rays in our clinic. We use digital x-rays. Many of you may have been sent for x-rays. Specifically, I and most of the chiropractors look at the neck predominantly, even though you've got problems with sciatica or your back or you've got fatigue or whatever you're struggling with. But the neck is so important in terms of function. The reason being, it's a weak structure, doesn't have ribs around it, huge musculature, it's close to your brain, and the top part of the neck, in these first three vertebrae, 1, 2, and 3, you have about 100% more density of neuroreceptors or muscle spindles in this area, actually feeding important information back to your brain. Also, the top of the neck, lower brainstem, that area controls your survival in terms of your heart, your blood pressure, your survival function, your breathing at that lower brainstem area. So it's so important that your neck's in a good position to allow all these body parts to work as well as possible. This is an example of a normal x-ray, side view. The x-ray is shooting through there. That's the nose, that's the back of the head. The spinal cord runs through here. The discs sit between the vertebral bodies, and these are the joints. Now that's a beautiful curve. It's about 40 degrees forward, and that's a nice anti-shock mechanism. It's a functional system. Now, we have some stresses over time. Maybe it's a whiplash, maybe it's just bad lifestyle, maybe not enough work, sitting in front of the computer, maybe divorces and breakdowns, and the whole body starts to become dysfunctional. We lose that curve, so we go to the next step of what we call phase 1 of degeneration. We've lost the curve, so the curve's gone from here, from a normal curve, to a straightened curve. So we've lost the normal curve, the soft tissues, the muscles, the ligaments, tendons are tight and scarring and inflamed. The brain's perception of this area is not going to be clear, because remember, you've got millions of joints in the spine. All these muscles, ligaments are telling the brain what's happening. Now the whole spine's changed position. And that's going to create symptoms. It may be minimal, it may be just a little bit of stiffness or a little lack of motion, which you may not even notice. You may get a headache, you may get some neck pain, you may get tension between your shoulder blades. It's very subjective how each of us feel this postural change. We leave in a few years, and what happens? We progress to phase 2, or this is phase 4, so I've skipped a few steps. But progressing over time, if we don't do anything about it, is we eventually will get very likely to a neck that's buckled with lots of arthritis. And this is phase 4 degeneration, with the discs very narrow. The curve in the neck should be like this, and now it's totally buckled, which is going to create real functional problems in terms of the brain's perception of where the body parts are. We have to remember it's all about the brain. The brain has maps of all your body parts. And the better the whole spine is talking to it and the information getting to the brain can control healing and function. So we have this curve which should be like this, and now we've now reversed the curve. The spinal cord will be stretched. Some research says that it will be stretched nearly up to 30%. And that's going to create symptoms. It's very subjective, but what we see with patients who've got reverse curves, patients have often gut issues, bloating, indigestion, because their stress response is now not adapting. Their brain and their system is not adapting to their environment, and everything's changing shape. This is a beautiful slide to really hit home how important posture is. If your head is above you and gravity's pushing down, your head weighs approximately 12 pounds. That's an efficient structure right there. Then our heads move forward 2 inches. You're now carrying 32 pounds instead of 12. How stressful is that? And now your head's forward 3 inches. That's 42 pounds. So every inch forward your head slides, you double the weight of the head. That is stressful, folks, and that's going to change your whole posture. The whole body's going to bow out of position. It's going to create aberrancies. It's going to create fatigue. It's going to create muscle tension, arthritis, etc. long term. Okay, so the solution, as we promised you, this is the big picture. We've talked about stress, we've talked about the spine, we've talked about the amount we spend on chronic disease. This is really the big picture. So ultimately, we all have a brain. Obviously, if you've got a mum, they'll tell you you don't have a brain often. That's still my mum telling me that. But the brain controls everything. It's the most important organ. The second most important organ in your body is your gut. They also call that the second brain. So the gut's down here. I'm going to draw it there. That's your gut. That's your second brain. It controls a lot of neural receptors. A lot of the immune system is in that gut, and that's why the gut is so important. So your brain controls everything. It's the #1 system in the body, the master system. And then the tail of the brain is the spinal cord that follows all the way, and then all these nerves exit to all your organs, muscles and tissues. So it's a very, very important structure. In order for the brain and the gut to work beautifully, there's 4 main things we need to work on. We need to make sure we have good oxygen. Oxygen comes from breathing properly, obviously, and we all think we breathe properly, but in this chronic, stressful environment, we often shallow breathe, we don't get oxygen to our system. Often poor posture, sitting in front of a computer, loss of curves in the neck, poor posture, kyphotic spine, joints not moving your spine are going to stop those ribs opening up to allow the lungs to fill up and get good exchange of gases. So oxygen is so important. That comes from good posture. Obviously it comes from food. You've got to be careful you don't have anemia, etc. And those must all be ruled out by your medical doctor, etc. But that's #1, oxygen. So we all have to breathe properly. There's a lot of breathing techniques we can do, and we do that in the clinic as well. #2, we have to have the right fuel. We need to eat properly. And we've already discussed this in terms of the stresses. We need to eat more vegetables and fruit and seeds and nuts and waters and clean food, alkaline food. You can Google that. Alkaline food, paleo diet, not too much meat, but good quality if we're going to eat it. That's the fuel. That brain needs that oxygen to fuel. Next, the brain needs movement. Movement is life. We've got to move beautifully. And that comes from exercising. We should be exercising at least half an hour a day, stretching our spine, exercising, doing squats, doing plank, a bit of running, etc. So movement is very, very important. #4, mindset. So it's upside down for you there, but mindset. So we talked about emotional stresses. The more we can control our mind is so powerful in healing. If you can control your mind and have positive mindset and think, I'm going to get over this, I'm going to work with someone, it's huge. Just thinking, I'm going to work with someone, I'm going to work as hard as I can, I'm going to change my lifestyle. Just showing up here is part of having a good mindset, so we're really proud of you in regard to that. But being a person whose glass is half full as opposed to half empty is a good start. So try and see the positive things in life. Always don't be negative about every aspect of your life. We're also lucky to be here in this Western world compared to a lot of the population of the world. We've got to change our mindset. So if we can change our mindset and say, I'm going to heal, I'm going to get healthier, that's a huge part of healing. So brain needs oxygen, fuel, proper movement, good mindset, and then it's going to work so much better. The gut will work so much better, especially if you eat the right fuel and you can heal the gut. And in functional medicine, there's a huge drive in terms of the brain-gut axis, gut-brain axis in terms of healing, because that's where it's all controlled from. And if you can work on those aspects, you work on that spine, work on the brain, work on the gut, your body has an amazing chance to heal. And that's what we really want for all of you. Before we finish, I'm just going to summarize a little bit in terms of some of the take-homes for you. And again, really appreciate you sitting here and joining us today. But we talked about how chronic disease has got worse and worse and worse. And we take an example as diabetes type 2. Did you know that it used to be called adult onset diabetes? And the reason it was called that is because quite a few years ago, 20, 30, 40 years ago, it was only a disease of adults. But do you know now that children get it, and that's why it's been changed, and it's called now diabetes type 2? That's a big, big, big worry. And did you know that children past baby age, from a 3 to 4, the biggest factor for death in children, and this is a horrible fact, is cancer. And again, cancer has grown, and the incidences of cancer have increased so much because of our chronic lifestyle. And we've got to look at that. If you want some more research behind that, there's a very famous geneticist called Bruce Lipton, and his book is called Biology of Belief. It's a very interesting read, so if you jot that down, try and get that. So to finally finish, I believe that in this Western world, every one of us should have a medical doctor, an emergency doctor. When we are struggling, we don't know what to do. In fact, I've had a patient who's just come as a new patient. She's just come in, she's in a lot of pain, and I've sent her for x-rays, but she just texted me this morning. She's in so much pain. I haven't treated her yet, but she's in so much pain. I'm worried she might have such a bad disc prolapse that we might not be able to help her. So she's in so much pain, I've sent her to A&E just to make sure that she can get some painkillers to help her deal with things and rule out anything that may need surgery. Now, I'm not for surgery, we should definitely go a conservative route first, but we want a medical doctor to help us with emergency care. On the other hand of that, we've talked about chronic disease, NHS is spending more and more, it's not working. So on the other hand, I believe that all of us should have a wellness doctor, such as us, a functional chiropractor who works in functional medicine, who's going to help you be healthier, to be the mechanic for your car alignment, help you with eating better, help you with moving better. And that way, I believe we could really make a great partnership and help each other to really get our health back on track. And with the scare that COVID-19 has brought to our Western world, if we look after ourselves, viruses will take a look at us and run, because they know that they can't overwhelm our bodies because our systems are so strong with such good function. And I challenge you all to challenge your family members and friends to say, come to this talk. We can always send you this talk on video as well once you come here. But to challenge yourself to get healthier, because this Western world is not getting healthier. And we've got to change what we're doing, because what we're doing at the moment is not right. I really wish you all the best. I hope you stick with treatment, because time with healing, it takes time. You've got to be a bit patient. You've got to stick with it. Don't just dip your toes in the water, and take time. Take time to make those changes, because it's often taking years by the time you come here. Give yourself a few months to start making changes, and I'm sure we'll help you. If you have any questions, you can always speak to the clinic manager or myself about any concerns you have. So have a wonderful evening, and again, thank you very much.